Ady Barkan is a Medicare-for-all advocate and suffers from ALS. And he recently had this exchange with Joe Biden that, if you're like me, it's going to piss you off. Watch this.
It's no secret that I support Medicare for all.
I don't.
And that I endorsed Elizabeth Warren and Bernie Sanders in the primary.
Both good people.
But you won the nomination, and I respect that, and I am fully committed to beating Donald Trump.
I know that.
Throughout the Democratic primary, you made clear your opposition to single-payer, Medicare for all, and you have won the nomination. But in recent months, 20 million Americans have lost their jobs and many have lost their health insurance with it. Democrats overwhelmingly support Medicare for all. And it's especially popular among young people. And even your friend, Barack Obama, said recently that it is a good idea.
Democrats aren't just running on good old ideas, they're running on good new ideas, like Medicare for all.
So my question is, do you see a future where health insurance is no longer tied to employment? Will America ever have a single-payer system where health care is guaranteed as a human right?
Health care guaranteed is a human right, but taking away the right to have a private plan if you want a private plan, I disagree with. There's three things that I propose that we can do, and we can do it quickly. I support a public option as well. We can get a public option passed, and we can get it passed quickly, number one. Number two, I propose spending almost $1 trillion to make sure that people can get a gold plan on Obamacare, subsidizing anyone who wants to get in with a gold plan. Number three, providing for the option to have home care paid for and elder care paid for. Not as part of Medicare, as just a basic right. It's an absolute basic right. And so I believe we can do all the things you want to do and do them better, more quickly than with Medicare for all. But we have the same goal because healthcare is a right, not a privilege. It should be a right, not a privilege.
Vice President, I hope you understand this issue is personal for me. This isn't abstract or theoretical. When I say I'm a Medicare for all advocate, I hope you understand it's because I've spent hours on hold with my insurance companies when they won't cover the cost of my care. It's because I've had to sue insurance companies when they tell me I need to pay thousands of dollars out of my own pocket for the cost of full-time care. And I have a great private insurance plan. I understand what you are saying about keeping private plans, but I guess my question is, what does preserving private insurance really do for people?
It depends on the plan. Look, you know what my bills were for my hospitalization? Were $280,000. I get it, man. I'm not new to this. I'm not where you are, but I get it. I fully get it. The cost of my sons were well over $1 million. That's why we have to do the additional things, like making sure that home health care is covered.
All right. Yeah. Joe Biden here is very focused on, we can get it passed quickly. Public option, we can get it passed quickly. Can't pass Medicare for all quickly. That's the real difference here. Get it passed quickly. You can get Medicare for all passed quickly as well. All it takes is the political will. All it takes is you whipping the votes. What the hell's the difference? Republicans are going to fight you just as hard on a public option as they're going to fight you on Medicare for all. There would be no difference at all in their fight against both. You think they're going to think, public option? Okay, I guess we'll go along with you. When have the Republicans ever just gone along with the Democrats on anything? They're going to fight you just as hard regardless of whatever plan you put up, meaning that it actually sides with the conversation sides with what Democrats are willing to fight for. So are you willing to fight for Medicare for all and whip the votes to get it done, or are you not? Biden's argument here is complete BS. When you look at the current system in the U.S., 45,000 people a year die due to a lack of access to health care. Canada, that doesn't exist in our single-payer system. In the American system, 500,000 people a year go bankrupt over medical costs, medical bills. Doesn't exist in Canada. Again, a single payer system. In Canada, if you lose your job, healthcare is still there. The exact same healthcare you had before, the same doctor, everything is still there because your employer and healthcare have nothing to do with one another. The healthcare that you had is always there. Say you don't like your job or you don't like your boss. You can leave that job, go work somewhere else or start a business or go back to school, and you still have that healthcare guaranteed to you. It doesn't change. Everybody pays into the same system. Another benefit of a Medicare for all system is that your Congress people and the wealthiest people in the country would also be on the same healthcare system as you. So how bad is it really going to get if they have to use the exact same healthcare system as you are? It's disgusting that even during a pandemic, with the amount of people that have the virus, the amount of people that are dying now with this virus, that still the Democratic Party, even with all of the facts, all of the data supporting a single-payer Medicare for all system, with the polling supporting a Medicare for all system, a majority of voters, not even just Democrats, a majority of all voters support Medicare for all. And if you poll just Democrats, it's like 85, 90%. But all voters support Medicare for all. They still won't back it. During a pandemic, with all the facts behind it, with people in support of it, they still will not back it. And it's because the Biden campaign has a ton of healthcare industry money backing them. And the Democratic Party in general has that healthcare industry money backing them. That is the only reason they will not support it. That doesn't mean you give up your fight. No, you continue fighting. You continue pushing. And if Biden wins, you push even harder. Because the fight is not over. Just because Bernie isn't the nominee doesn't mean that change isn't possible. If people get loud enough and are not going to take this BS anymore, things will change. It has to change. You have to make the lives of these people miserable. The people in power that are preventing your society from having a single payer system, you have to make their lives miserable. Now, Biden also brought up, oh, I know what it's like. I know what it's like. I have healthcare bills too. He's right in the sense that he also had healthcare bills. And guess what? Obama offered money to help support him. Joe Biden was in a situation, a very privileged situation, by the way, where Joe Biden, at the time of this happening, in the top 2% of society. The top 2% in terms of income. And he still had problems paying his healthcare bills. So how can he not understand and wake up to the reality that most people are not as privileged as he is, or as he was in this situation? Most people don't have the money that he made. Can he understand that what he was in, the debt that he had, is even worse for somebody who's making nowhere near what he makes? Yet still, it's incredible. It really is incredible. The amount of bullshit these people will throw in your face with all the facts, all the data behind a single payer Medicare for all system. They're complete lack of empathy. And then pretending, oh, we can never get it done. They can absolutely get it done. All it takes is the political will to fight for it.